slides, which is a great segue, Miranda, to our next slide, which hopefully will come up now. And that's, I guess, just common mistakes that people make when they're presenting. I'm of the view that less is more. Quite often you get, and I think the more often that you present, you sort of these things come naturally, and you're able to eliminate it through trial and error. But too much text, having something like that on slides, but we'll just lose people straight away. They'll either be lost because they're trying to read it, or they've just tuned out because it's information overload, and it's just not a good way in which to present, I guess, concise information. Um, PowerPoint
Dragan.
slides are fantastic. Yeah, go ahead,
Oh,
Miranda.
sorry. It was just a comment from Mansour who says that he's told about the rule of 5 words per line and 5 lines per slide.
Yep, yeah, exactly. So I was going to go along those lines. Um, the fewer words, I guess, or the least amount of information that you can get away with on a PowerPoint slide, the better. And hopefully over the next couple of slides, I'll show you that. Again, trying to use PowerPoints as a way to facilitate your presentation rather than as the crutch is useful. I mean, I haven't practiced what I preach here, but I try and, when I give presentations, limit the amount of slides that I have with words to as few as possible. I rather go with pictures and use that as a reference point, again, to tell a story. So again, we'll touch on that in a few slides' time. But definitely agree that if you're going to use sort of the slides for the sentences and whatnot, the 5x5 approach is fantastic. One of my pet hates, colour. I'm sure everyone's been in this situation before when they've been in a presentation and someone's got a white background and yellow writing, or vice versa, and it's just so distracting. So once again, I think people fall into this trap because they're trying to make it all about the presentation and trying to make the presentation as exciting as possible. Whereas sometimes it's, simple is good. I always adhere to the KISS principle. Keep it simple, and for the most time that works, and we're seeing it, I guess, translate into practice these days with a lot of the infographics that are presented, particularly with patient education materials, where once upon a time there was almost an information overload, whereas these days it's the simpler the better. The next I guess aspect that I wanted to talk about was animations, and again, I quite like using animations. For example, when I'm trying to get across certain aspects, certain concepts, so study designs and whatnot, rather than having slides filled with text and whatnot, I will just use an animation to demonstrate, I guess, the concept and how it differs from others. Having said that, again, animations are fantastic if you keep them simple, and they allow you to also work through the concept as you go along. So in this case, this is an example of, if we were talking about randomized controlled trials, and say here's a sample of patients with a history of myocardial infarct. We've got a nice arrow to demonstrate that it's prospective in its design. We have that randomization. So again, it's a point in which we can then talk about randomization and the implications of randomization and what effects it has on selection bias, etc. So it allows you, I guess, to introduce concepts which you can then go into further detail down the track. Where I get into trouble is when you start doing these crazy animations, which at the time, at 10 o'clock at night, seems really good, and you think that you're being fantastic, but these sort of revolving things and sound effects and whatnot, to be honest, I've never seen a presentation where the sound effects or whatnot have been useful.
Dragan,
Seems
Janina,
like it is.
uh, sorry to
Yeah.
interrupt. Janina has a question. Janina, your microphone's on if you'd like to say something.
Yep.
I can't hear Janina. Perhaps your microphone's not working. Janina, do you want to write your question in the questions box and we'll come back to it in a moment? Nancy's also noticed in the questions box that it's more like 3 a.m. when she's writing her slides. And Claudia's wondering which programs you use for the animations.
Look, I'm fairly basic. I just use PowerPoint for all my animations. So just using the animations icon in PowerPoint, and then you can choose the variations in terms of whether they fly in or appear or whatnot. Again, I try and steer away from things like this where yeah, you have sound effects and whatnot. So I try and keep it as simple as possible. Were there any other questions there, or have we got?
Not at the moment.
No?
Haven't.
Okay. Well, if there are, well, again, feel free to ask. Otherwise, we'll move on. Um, text. Again, this is useful if the presenter can actually remember what the text stands for. But again, it's going back to that KISS principle of keeping it as simple as possible, not using jargon and not overwhelming the audience members with information. This is a table from something. It's telling me something. I've got no idea what it is because I can't recall what the acronyms and whatnot stand for. So again, just to highlight that this type of text, may be useful on the very odd occasion, but in majority of cases, it's just confusing. And again, it's a potential point in which you can lose your audience members. And once you've lost your audience members, it's really difficult at times to get them back interested in and engaged with the presentation. Just the last thing that I was going to touch on in terms of presenting using PowerPoint presentation, and I've got a screenshot there of my poor handwriting. I actually took that a little while ago, and then I was reading through it, and I've got to admit it took me a while to read through or try and decipher some of the text that I'd written there. For example, down the bottom, it looked like I'd written, I was trying to decipher cross dialysis or something. I thought, well, geez, I've got nothing to do with dialysis. And then I realized that dialysis was disciplines. So I guess what we're trying to highlight there is using PowerPoint, it's fantastic, but again, it's only really an extension of your personality and to some extent your handwriting skills as well. I think people often sort of get a little bit carried away with PowerPoint, particularly with the fonts, and they start getting a little bit fancy. So they start putting in examples like this. In terms of the fonts and whatnot, again, it's quite nice to be boring, to be honest. One or two fonts, so having a font for headings and a separate font for the body of the text is quite useful. The type of font that you use again can dictate how audience members interpret the presentation and the material. So putting something in Comic Sans, you sort of lose a little bit of the seriousness of it, and having something like this just makes you look like you're out of the Wild West or something like that. So again, just sticking to simple, clear text and fonts. Arial is popular because for that very reason. So again, just something nice and clear. So I mentioned that with PowerPoint presentations, I try and use as many pictures as I can. I know early in my career I was one of these people that would write their presentation, write notes, and try and stick to the script, so to speak, and then over time lost the script, but would still be fairly closely aligned to the presentation. These days, I guess, as I mentioned, being comfortable with the material give you a bit of freedom to be a bit more creative with the presentation. So I tend to try and use PowerPoints and only incorporate pictures if I possibly can. I've had a few times where I've done an entire lecture just based on pictures, so that sort of made me quite happy. But examples such as Dr. Spock, I'll use that to highlight, in this case, when we're talking about evidence-based practice and Cochrane reviews, the worth of evidence-based practice as such. So I'll tell the story of Dr. Spock and his book of baby and child care, and how his main message, or one of the main messages out there, was this notion that babies should be put to sleep on their fronts. And so that provides them a nice, I guess, way in which we can engage with the audience and start discussing the importance of evidence-based practice without having necessarily to get into the theory of it, sort of, talking about the classic definitions of it.
Dragan, Nancy's made a comment that she tends to use pictures when she knows the audience all speak English or the same language as the presenter, but when there's a mixed audience with different languages, she worries about only using pictures.
Yeah, look, that's a very, very valid point. So, I agree with that, and if we were presenting at an international conference and it was sort of quite technical, the detail, I also would probably steer away from the pictures. But again, I guess it depends on the type of presentation and the audience, as you suggested, Nancy. Similarly, I guess, in the past, when we've been teaching Pico, again, Pico can be a bit of a dry concept to discuss at times with participants. So again, rather than running through the notion of patients and interventions and comparisons, etc., I tend to use this particular scenario and this particular picture to demonstrate that. So we might have a bit of a stab at it. Can anyone tell me who this or what this advertisement, who they're targeting? Is my attempt at trying to engage with you guys.
You can type it in the box, or you can raise your hand if you like. We'll give them a second to type. And while they do that, Dragan, I'm just Nancy suggested women who are maybe aging a little.
Yep. Fantastic. And
yeah,
quite often I get middle-aged women here. Yeah. I was just going to say, quite often I get this notion of people saying, oh, they're targeting middle-aged women, and I often get into trouble by saying, what is a middle-aged woman? So I won't ask that. So yep. So they're advertising or aiming at middle-aged women, and I think you get the notion that we run through that. We talk about, okay, well, what are they trying to sell us? And usually we talk about this cream. What are they saying will happen if we get this cream? So we can run through this notion of Pico just by using this this picture, and it's I guess a different way to discuss Pico, but an alternate way, particularly when you've got a day in which you're heavy on theory, which you can sort of break it up, and these sort of examples I think tend to stick with people. So the more of these examples that you can incorporate in a presentation, I think the more chance you have of the audience members coming away with something.
Dragan, Vanessa's asked a question about, I guess it's about students using the slides to study later. So she wants to know, do you find students get cross if they can't get the main information off the slides, if they haven't paid attention during class, they can't use the pictures for their studying?
Look, this might sound weird, but I've never had that. No, I've never had that with students. I know they can be fairly sort of demanding, but I'll say, look, my sort of view on the presentation is that it is a presentation. It's I'm just trying to colouring the theory with a bit of colour, and if you really want to know the theory, then I sort of refer them to essential readings that we give them. But the presentation is more about sort of engaging in and sort of colouring the theory, so to speak.